How can you understand complex neurological exam findings? Imagine trying to solve a puzzle where each piece reveals something about how your brain and nervous system are functioning. That's what a neurological exam aims to do, especially when doctors are trying to figure out if a brain tumor might be involved. The exam is a step-by-step process that looks at different parts of your nervous system, including your brain, spinal cord, and nerves. It's usually done by a neurologist or a trained specialist and is painless. The goal is to spot signs that something isn't working right, like changes in vision, hearing, muscle strength, or coordination. These signs can point to areas in the brain that might be affected by a tumor or other neurological issues. The exam covers several key areas. First, testing the cranial nerves, which are 12 nerves that come directly from the brain. For example, if your eye movements are abnormal, it could mean the nerves controlling eye muscles are affected. If facial sensation or chewing feels different, it might involve the trigeminal nerve. Next, the doctor checks your muscle strength and tone, as well as your sensory perception, to see if there are any localized problems. They also assess your coordination and walking pattern, which can reveal issues with the cerebellum, the part of the brain that controls balance and movement. Reflex tests are also important because abnormal reflexes can indicate damage to upper or lower motor neurons, which are nerve pathways that control muscle movements. To make sense of these findings, clinicians often use standardized tools like the nanoscale. This scale helps quantify how well your nervous system is functioning by rating 9 different areas such as limb strength, speech, gait, and consciousness. It provides clear levels from normal to severely impaired, making it easier to track changes over time and communicate findings consistently. This is especially useful in patients with brain tumors, where neurological status can change as the disease progresses or responds to treatment. Understanding what these exam results mean also depends on combining them with imaging tests like magnetic resonance imaging, or MRI. MRI scans give a detailed picture of the brain, showing the size, location, and effects of a tumor on surrounding tissue. For example, if a patient has weakness in one arm, the MRI might reveal a lesion in the motor pathways controlling that arm. When exam findings and imaging results are considered together, doctors can better understand the nature of the problem. However, interpreting complex neurological signs isn't always straightforward. Some deficits can be subtle or overlap with other conditions, making experience important. Tumors can also cause indirect effects, such as increased pressure inside the skull, which might show up as swelling of the optic disc in the eye. Additionally, some neurological signs might be influenced by treatments or other health issues, which can make diagnosis more challenging. In practice, understanding these exam findings helps in many ways. It allows for early detection of brain tumors by recognizing specific neurological deficits. It also helps monitor how the disease is progressing or responding to treatment by tracking changes in neurological function over time. Furthermore, these findings guide further testing and treatment decisions, ensuring that patients receive the most appropriate care. In summary, grasping complex neurological exam findings involves a careful, structured approach that combines clinical observations, standardized assessment tools, and imaging studies. It requires understanding how different parts of the brain and nervous system work together, and how tumors can disrupt these functions. Always remember, each person's situation is unique, and medical professionals are best equipped to interpret these signs in the context of individual health. If you or someone you know has neurological symptoms, consulting a healthcare provider is essential for accurate diagnosis and personalized care.